really nature is about self-care and it's about community care. And while you as urban natural resources and urban forestry and arboriculture specialists have been well aware of that for some time, personally and in a more civic role, I am seeing that there's greater attention to this. There's a better understanding across our society of the importance of nature for restorative, contemplative experiences and for solace, frankly, in these times and in the drastic changes of our lives. So let me very quickly again, about 30 minutes or so, review of trees and health evidence. Then I'm going to spin to mental health because that's becoming a major issue from a public health perspective during this time of COVID. It was as well prior to, but I'm seeing greater prominence of attention in the public health arena to mental health. And then I'll talk about trees and EJ a little bit. And let me qualify that in that I will be speaking about this from a more quantitative analytic standpoint. And yet I know from personal stories, experiences, and also now from other webinars that there are very in place, in community concerns about EJ and racism, as Sarah introduced. I can't speak to that because I am not a person of color. This is a project that I've been working on, funded by Tree Fund, Urban Forests for Human Health, a focused economic valuation. And what we have done with that project, just 2 months ago, published an article. And you might be interested in taking a look at this. It's actually open access. It's available. No, you don't have to pay for it. Urban Trees and Human Health, with a wonderful collaboration, unusual collaboration for me. A lot of colleagues in Canada, Natural Resources Canada, Health Canada, University of British Columbia. In addition to that, a number of the authors, co-authors, have a background in public health. Matilda Vanden Bosch is a physician. So this combination and integration of urban forestry, research evidence, public health, and medicine was a very satisfying collaboration for me. And here's what we found. Here's one representation. We first screened a number of databases and found, gosh, thousands of articles. And then using science screening approaches, we arrived at about 200 studies that we proceeded into the review activity. And there were 3 general categories of benefit, health benefit provided by trees. Building capacities. How do trees provide, and the urban forests provide, a foundation of wellness for everyone? Restoring capacities. Say you have a falter in your health. Things aren't going so well, either near term or long term. How do trees help improve or heal or provide therapy in those situations? And finally, reducing harm. There are a lot of things in our general environment in terms of air quality, water quality, heat now, of course, this summer in many parts of the country, and we're experiencing that a little bit here in the Pacific Northwest. What are the consequences of heat on human health? And how might the presence of trees help to reduce those harms? Then you see in the middle there, the array of different health benefits, very generally classified. And in the article, we go into great detail about each of those benefits and what the evidence suggests. And it's not always positive. Some of the studies had mixed results. One or some of their measures did not show any effect, while others did. And there are actually studies where there was evidence of negative effects of trees on health. And one instance in particular, I want to call your attention to that bottom bar, tree pollen. There are a lot of studies out there, well, not a lot in the world of science, but look at, approximately 20 studies calling out tree pollen as allergens. And what's important to know, should you be interacting with public health officials or people in the realm of medicine, is the health and medical article databases pushed up these articles about pollen and allergies far more than they did about the other benefits provided by trees. So what I'm suggesting is in your conversations with people in the health arena, they may not have awareness of these other benefits. They may have only been brought to attention pollen consequences, pollen and allergens. So help them understand there's a broader set of benefits here. And down at the bottom of the slide there is that source, is that article. Again, it's available for free if you want to download it. Here's another representation of the research. And both of these figures were prepared by Sharon Lamb, one of the collaborating authors. Here again, we see tree setting, quite a variety of different sorts of settings and experiences of trees that were found in the studies. Then those three domains, which I described, reducing harm, capacities. Then the subdomain, which means the benefit report. And what this is showing, going from left to right, is the number of articles. So those gray bands represent the number of articles. And you can see this really interesting flow of tree setting, domain, subdomain. What I call to your attention on this particular slide is look at the time of publication on the right. Just in this last decade, and we haven't even completed the analysis to 2020, is that the pace of this publication is surging now. There's a lot of work coming out from all over the world. Forest bathing from Japan, China, and South Korea. Restorative experiences from Northern Europe and here in North America. Just quite a wide array. Pollen, a lot of pollen stuff coming out of Europe. Maybe where they have had denser residential settings for a longer period of time. So anyway, this is capturing the attention of scientists. And when I started in all this, I got questions like, why are you doing this science? What is this? And now, of course, we're seeing some of the best and brightest young PhDs, young scientists coming to this work, which is really heartening for me. So ultimately, and we're continuing this analysis, what are the economic consequences of all of these findings? And, you know, Econ 101, supply, demand, that establishes price. Really hard to set this up for trees and health, you know, civic trees, trees in our public realm, and health consequences. Because the costs are indirect, the benefits are indirect, not only readily measurable. So we're struggling through this. We're struggling through this puzzle, if you will. What I will know is general trends that you might find interesting to talk about, and that is general wellness. Having trees in our neighborhoods, our surroundings, even our yards. Maybe you can see in the window in the background, I got a couple of really large Western red cedar in our yard. And I just love going out in those trees, particularly when it's warm like this. The temperature's so much cooler. Anyway, having trees in our broader environment contribute to general wellness. They help reduce stress. They help reduce anxiety. And those consequences for health are not near term. They're hard to evaluate from an economic perspective, but they set up better health over time, over a year, over decades, over our lifespan, if you will. Therapy and treatment, though, we found a number of studies, if someone had a particular clinical diagnosis, such as depression, or in their hospital and they're healing from surgery, then it's a little easier to measure how the presence of trees or experience of the urban forest helps reduce the costs of therapy or treatments or time spent in a healthcare facility. So generally, trees contribute to wellness. The urban forest contributes to wellness, also helps out with therapy and treatment. From an economic standpoint, it's a little easier to understand the economic consequences of those direct therapies and treatments. I'm going to move on now to mental health, because mental health for some time now has been a rising concern in the public health arena. But with COVID, we are seeing ever greater consequences. The article on the left was published in April. It was the first of a number of call outs about what are the mental health results or implications of stay at home and not being able to interact with people in normal ways, limitations of kids not being able to go to school and so on. And that understanding and also the concerns about public health have been elevated. So on the right, it was an article published just a few days ago, and they're starting to identify which segments of our broader society are more susceptible to mental health concerns in the era of COVID. I'm going to share with you from our review are some of the studies that suggest how having trees, the urban forest, and nearby nature more broadly can be very valuable for mental health. So here's one: physical activity, so important. People, if they can, get outside, social distance, masks, but still even brief walks, brief times outdoors, moving about, cycling, that sort of thing can be very helpful. And this study found that movement indoors versus outdoors both provided benefit, but outdoors provided more benefit in a measurable way. And we see that then having urban greening is more than exercise. Physical activity is important, and there's all sorts of guidelines for how much physical activity we should have in a week for different age groups, adults versus children. But what these studies are suggesting, the studies that we reviewed, is that it is more than exercise. There are additional co-benefits associated with activity outdoors. And if you're interested in digging into this idea and these findings a little bit more, a colleague of mine, Greg Brotman here at the University of Washington, published a review in Science Advances about nature and mental health. And they went through this rather elaborate framework. He and his co-authors went through this elaborate framework of how we understand that mental health might be boosted by encounters with nature. And again, what they found was very generally, they didn't describe it in this way. There's general wellness, the value of having this broader environment of green around us. And then in those specific instances of therapy and treatment, how might they be valuable? General wellness can include school performance, stress reduction, attention restoration. I'll talk about this a little bit. Creativity, therapy, attention deficit. You've probably heard about some of these studies. ADHD, emotional therapy, depression reduction, and so on. And some interesting work coming along now about dementia and cognitive disorders. So as we age, what might be the role of nature in lessening the effects, or maybe even delaying the onset of some of these disorders. Also some really interesting stuff about schizophrenia, but I digress, so I'll continue here. Here's a study that was done by a team at the University of Michigan. And what they did was to ask people to go outdoors, their choice of where to go. Garden, sit under a tree, forest bathing, whatever it might be, their choice. And it was a fairly rigorous experiment. And what they found was reduced salivary cortisol, which is an indicator of stress, a very reliable indicator of stress. What they found, what's key here is dosage. They found that 20 to 30 minutes was optimal. So prior to that, there was not as much stress reduction. After that, you saw a diminishing return on the curve. So more was good, but not that sweet spot of 20 to 30 minutes. They found to be quite valuable. And then also they found that people who were least active, the couch potatoes, right? Get them up outdoors. Whoa, that really helped with stress biomarkers. So identifying those people that by choice or lack of awareness perhaps, or they don't have the opportunities in their environment, are less active. If we can help boost their activity level, there can be a lot of benefit from that. Here's another study. People who were diagnosed with depression. It was an experiment. They were randomly assigned. You walk in a more green space, the green route. You walk in a more highly built space, the red line. Then after a period of time, these switched. So there was control across the groups because it was the same people. And Mark Berman and his colleagues found that there was improved symptoms of depression. And again, these were 1 hour walks. brief amount of time, right? And they weren't every day, they were intermittent. So we don't have to do this every day, but a routine, the studies are showing having a routine of these nature encounters is what's important. Neuroscience, again, some of the best and brightest are coming to this, and neuroscience is starting to happen, which is so cool. But here's a study, what they found was a 90-minute walk. So we're seeing this different dosage sort of, it's starting to settle in. What is the dosage that we need for a variety of benefits and over different amounts of time, maybe for different conditions, health conditions. Rumination, though, is something that is quite interesting. So when we're depressed or anxious, we tend to ruminate. And that is not like a deer, digestion. This is about mental rumination. This is about grabbing hold of negative thoughts and just drilling down and an ever more negative spiral. Well, the studies are showing that being out in nature, sitting, walking, can help pull us back from that negative spiral of rumination, which then can help alleviate depression, anxiety, stress, and a whole suite of other mental health consequences. And go solo, go with a group. In England, the recognition of the mental health effects or consequences of loneliness, there is now a minister of loneliness in their National Health Service in England. And part of their health promotion is group walks. Set up the circumstances, set up the programs, welcome people to walk if they're more social, so they have this opportunity, and they're finding an array of positive outcomes from this sort of activity. Biodiversity. So some of you may be working more in ecological restoration, others of you in more formal parks. Biodiversity is starting to emerge. Ecologists are joining with mental health specialists and doing these studies, and they're finding that more diversity of vegetation, more experiences of birds seems to be helpful in mental health recovery as well. And my daughter, as I was tinkering with some of these ideas, my daughter sent me this slide. And she said, "Mom, is this real or is this Photoshop?" And I explained to her, "Hey, kiddo, you grew up here in the Pacific Northwest. These are indigo buntings. You've probably never seen them because they're out east. But isn't that a fabulous picture of indigo buntings in migration?" Stress response. Here was another study done by Bill Sullivan. You may remember Bill Sullivan, Ming Kuo of the Chicago Public Housing, a series of studies. I was surprised to see they did that quite a while ago now, decades ago, but his more current work is in a lab. They showed people different gradations of urban forest canopy in residential areas, and then they measured stress response. And this is quite interesting. So the red line represents the display of canopy. So it's an even line because they controlled that presentation. The blue line represents stress response. So a higher reading represents more diminishment of stress. So higher reading is better for health. So you see a fairly constant, somewhat erratic, but fairly constant improvement in stress response with more canopy. But what's interesting here, look at about 39, 40-ish%. That curve starts to level off. So again, dosage, maybe 40% canopy is sort of a sweet spot in terms of mental health, ecosystem services, environmental performance and function. We're starting to see perhaps then an overlap in the full array of ecosystem services and how we engage with the public about why canopy is important. An underlying theory in all of this, so there's a lot of studies that say trees, or show that trees, canopy, images, forest bathing, health outcome, and mental health outcome. And the question is why? Well, we don't understand that completely. One theory that has been out for some time is this idea of attention restoration theory. And that is life, work, school, throws at us a lot of need for attention, focus, and that cognitive ability to do all of that can be depleted. And then we become irritable. We become frustrated, we become angry. I find this all the time, particularly now in the time of COVID. I work for, work on the screen, and I find like, oh gosh, I'm fried. So I go out in my yard or on the street and walk about for a bit and very directly pay attention to the trees, the birds, the weeds, the flowers, whatever it may be. And I can come back in 15 or 20 minutes and I'm replenished and ready to roll again. And that's what attention restoration theory is all about. What are the elements of ART? There's some conditions that have been found by research that emphasize this restorative experience, and that is being away, not going away from the city, not a long trip, but finding that space where you do feel like you're in a little different zone. You're in a different kind of space that envelops you, and that space has soft fascination. There are bits of nature that capture your attention involuntarily. You don't have to focus. So I have a patch of lavender in my yard outside that window there, and the bees are crazy on that now. And I love just hanging out around the lavender and watching the bees and observing their behavior. That is soft fascination. I have a hummingbird feeder outside a window on the other side of the house, watching those hummingbirds and their activity and their interaction. Soft fascination. Compatibility, that these nature settings, you feel comfortable in them. Is there seating? Do you feel safe? Do you feel secure? All of that contributes to the restorative experience. It is profoundly important for our health to have these sorts of experiences for everyone. And simultaneously, we have learned through big data analysis across many, many cities in the US and indeed around the world that there are disparities in the distribution of trees and canopies. So here was one study that was done just a bit ago, looking at a number of cities in one state in the US and finding that the darker green, which is more canopy, unevenly distributed. And not surprising, those distributions are associated with people of color, socioeconomic conditions, and structural racism, as we're seeing now with redlining studies with regard to redlining and the distribution of trees in cities. Locally, there's been some canopy analysis that has attempted to understand this, in part to respond, in part to create better policy, in part to engage with communities. So here we see communities of color, the darker green, the circles represent the canopy cover across that census tract. And not directly, again, it's not linear, it's an erratic sort of association, but we do see a trend that more affluence, more resources tends to be more trees. And I have found that Tacoma, I wasn't sure, I wasn't able to look up the data analysis. I couldn't tell whether it was 2010 or more recent, but we see here a similar communities of color, socioeconomic, lower socioeconomic status, darker red, tree canopy, more tree canopy, larger circle. Just visually, I didn't spend a lot of time with this, but a visual look at this compared to Seattle is I don't see quite as clear an association of more resource communities and tree canopy. And that may be, perhaps I understand that the city of Tacoma does not have as high a canopy percentage rate. And with fewer trees, maybe this association is not quite as clear or as direct in some other places such as Seattle, which is now pushing 28–30% canopy. These disparities are raising all sorts of ideas about how to approach and engage communities with regard to trees, but in a way that is sensitive to the character, the history, and the legacy of those communities. Just a fascinating amount of idea generation. There's a lot of froth now. There's a lot of new thought, and a lot of activity about how to do this responsibly, not just, hey, well, let's go in there and plant trees, but how to responsibly interact with communities about their needs with relation to trees, with relation to parks, with relation to other needs that also exist with regard to health. And so some really interesting articles coming along and maybe I should share a list of these with Sarah. She can perhaps pass those along with all of you. This is one of the more interesting that I've read by Jennifer Wolch, Jason, and Joshua. Jennifer was at UCLA at the time. She's now at UC Berkeley. And this idea of just green enough. What is enough nature introduction to gain benefit, but not to tip this community into a new character that might invite gentrification or displacement? And so this idea, this concern about gentrification, I have some thoughts about it. I think, haven't analyzed it, but that trees and green are not the cause of gentrification and displacement, but they're a signal of some very deep and wide economic things that are going on with a community whereby this can happen. And if we're not careful, greening can be a part of that. So again, this is a anti-displacement strategy document that just came out a short while ago, and I find it really helpful. It focuses on parks, but I think there's some lessons to be learned about urban forestry programs as well. So there you are. This is my online CV if you want to learn any more about some of the other work I'm doing. And I will be sharing these slides with Sarah. She can pass them on to you. And now I see we have some time for questions, comments, suggestions. I'm looking forward to this. What I've shared with you is we did a review. It's 200 studies with regard specifically about trees and health. I will mention that I continue to monitor the broader arena of nature and health literature, and I'm at about 5,000 articles. So the tree and nature is but a small bit of the broader understanding of why nature is important in our communities. And mental health is rising in prominence as a public health concern. That has been going on now for a little bit of time, but COVID, the consequences of COVID and the changes in our lives has really elevated that,